I don't know whether you have already voted or whether you are going to vote immediately after here, but we would like to appreciate you for finding time at short notice and for coming to be part of this media briefing. Now, the title of my statement, which I am just going to read to you, is Uganda declares the end of the 2026 Ebola disease outbreak. And today is the 28th of July, 2026. So permit me to just go through the statement, then after which you may pose questions or points of clarification, if any, and then we shall respond to them and then conclude. Now, the Ministry of Health is pleased to announce that Uganda has officially declared the end of 2026 Ebola disease outbreak. So today, as we speak now, Uganda is Ebola-free. The declaration follows the successful completion of the mandatory 42-day monitoring period, which began after the discharge of the last Ugandan national, a locally transmitted patient, on the 16th of June, 2026. Throughout this period, the Ministry of Health maintained intensive surveillance nationwide, and no new Ebola cases have been detected. Unlike previous Ebola outbreaks that informed the 42-day declaration policy, Uganda's 2026 Ebola outbreak arose from a fully documented importation event. The source of infection was identified, the route of introduction established, all confirmed cases were epidemiologically linked, transmission chains were completely characterized and reconstructed, and all identified contacts were institutionally quarantined and completed the mandatory 21-day follow-up without evidence of further transmission. Enhanced surveillance has detected no unexplained community transmission. I must hasten to add that we are counting from the last Ugandan national who was discharged, because the last case that we discharged of a Congolese national was a gentleman who came in a cargo truck, hiding in a cargo truck, and he was the last patient we discharged, but he had no contacts at all. And therefore we are counting from the last Ugandan national whom we discharged on the 16th of June, 2026, and counting today, we have completed the 42 days. Since the development of the current international guidance, significant advances have transformed outbreak investigation and response. Today, rapid molecular diagnostics, whole genome sequencing, digital surveillance, real-time contact tracing, and strengthened incident management systems provide a level of epidemiological certainty that was not previously possible. These advances have been particularly important during the current outbreak. Epidemic analyses have confirmed that the circulating virus represents a distinct individual virus variant, while additional evolutionary studies continue to expand our understanding of how this outbreak emerged. Together, these findings demonstrate that scientific knowledge of Ebola viruses continues to evolve. The ministry recognizes that the long-standing 42-day criterion has served the global public health community well and remains an essential safeguard in outbreaks where transmission is uncertain or ongoing. However, where an outbreak results from a fully characterized imported event and epidemiological closure has been conclusively demonstrated, a fixed time interval alone may no longer represent the only basis for determining that transmission has ended. Declared the Ebola outbreak on the 15th day of May 2026, following the confirmation of imported cases from the Democratic Republic of Congo, DRC. During the outbreak, Uganda registered a total of 20 confirmed cases, of whom 18 recovered, while 2 unfortunately lost their lives. Of these cases, 15 were imported from the DRC, while 5 were Ugandan nationals who acquired the infection as care workers of the imported cases. I also hasten to add that the 2 who died were Congolese nationals who had traveled into Uganda for medical care, but they came late, and that's why they died. Uganda has defeated this outbreak because of the strong investments the government has made over the years in building resilient public health systems. Our ability to quickly detect cases, trace and monitor contacts, provide quality treatment, strengthen laboratory services, and work closely with the communities ensured that the outbreak was rapidly brought under control. This achievement also reflects the commitment and professionalism of our frontline health workers, the vigilance of communities, and the close collaboration between the government, local leaders, security agencies, and partners. And we extend our appreciation to all these friends, ranging from health workers to members of the community that have been very vigilant and playing their role. As part of our regional response, the government of Uganda signed a memorandum of understanding with the government of DRC to implement a cross-border joint Ebola response. In light of this, Uganda has set up 2 mobile laboratories and an 80-bed Ebola treatment units in Aru and Kasenyi in the DRC. Containing the outbreak at its source is critical, protecting both our countries and the wider region. The Ministry of Health expresses its sincere appreciation to His Excellency the President of the Republic of Uganda for his unwavering leadership and support throughout the response. We equally thank our frontline health workers, district local governments, community health workers, security agencies, communities, you, the media, researchers, partners, and all Ugandans for your relentless hard work and sacrifice. Although Uganda is now Ebola-free, our work does not stop here. We will continue strengthening surveillance, maintaining preparedness across the country, particularly the border districts, and working with neighboring countries to safeguard the health and well-being of our people. The Ministry of Health appeals to the border communities to remain alert and report any illegal entry of persons into the country. Persons with suspected symptoms should be taken to the nearest health facility and also report through our toll-free line 0800 100 066. Let me repeat that persons with suspected symptoms should be taken to the nearest health facility and also report through our toll-free line, which is 0800 100 066, or send an alert SMS to 6767. The Ministry of Health wishes to assure all Ugandans, visitors, investors, and members of the international community that Uganda is safe. Our health system remains fully alert, and the country is open for business, tourism, and all socio-economic activities. I say this for God and my country. So thank you. Say, beginning today, Uganda is Ebola-free, and I now invite questions, comments, or any points of clarification. Would you want me to start with Uganda straight away? Nonetheless, you will get what I'm saying. Olwaleero tuli basanyufu tuzze wano ng'abakulembeze ba ministry ery'obulamu, ate ndi wano n'abakulu, n'omukulu Minister Charles Ayume, nina Permanent Secretary w'ekitiibwa Dr. Nkitulangirira nti okutandika n'olunaku olwaleero tetukyalina ekirwadde ekya Ebola mu Uganda, kubanga mujjukira nti mu mwezi ogwokutaano ennaku 15 twalangirira nti tulina ekirwadde ekya Ebola mu Uganda, kubanga twafuna omusajja Omukongo eyajja mu Uganda ng'anoonya obujjanjabi n'afa, naye ne tumujja kukoza sample ne tusanga nti yali alina ekirwadde ekya Ebola. Okuva olunaku ogwa 15 Meeyi twafuna abantu 20 abatestinga ngo balina akawuka aka Ebola, ate ku 25 bali ba Congo, bakwano baffe Congo abayingira mu Uganda ngo banoonya obujjanjabi. Katwasembayo okusiibula omulwadde Omunayuganda ennaku 16 mu mwezi ogw'omukaaga 2026. Katukuva olunaku ogwa 16 June okutuuka leero katuwezezza ennaku 42, kubanga mu gy'ekisawo omukujjanjaba ekirwadde kya Ebola tubala ennaku 42 wakamala okusiibula omulwadde asembayo. Waliwo omulwadde Omukongo gwe twasiibula ennaku 16 omwezi guno, naye oyo yava Congo ngu motoka eya cargo, so teyabeera ne contacts. Oyo tetubalira ku oyo, tubalira ku onu Omunayuganda owafuna ekirwadde, ate twali tulowooza nti waliwo risiki y'okusaasaanya ekirwadde n'abeera ne contacts. Kati kitegeeza nti kuva 16 omwezi ogwa June ngu twakasiibula omulwadde tetufunangayo omulwadde omulala wa testinga positive oba ngu alina obubonero obw'ekirwadde ekya Ebola. So kati tukakasa nti mu Uganda tetukyalina ekirwadde ekya Ebola. Lwaki olwaleero ennaku 28 omwezi ogw'omusanvu ngu tumaze ennaku 42 okuva olunaku luli ogwa 16 June twasiibula Omunayuganda. Kati tukakasa nti mu Uganda tetukyalina ekirwadde ekya Ebola. So twagala okulangirira, naye tekitegeeza nti twebake, kubanga mu Ebola gye twafuna yava eri Congo, ate mu ggwanga lya Congo Ebola ekyaliyo. Kati tusaba Abanayuganda ababeera ku border ne Congo nti babeere bali alert essaawa yonna. Bw'obalaba omuntu nga atolose Congo n'ayingira mu Uganda, babuulire ab'ebyobufuzi, ab'ebyokwerinda oba abakulembeze baffe, bagambe nti ono abadde Congo ayingidde mu Uganda, kubanga twakola endagaano wakati ye gavumenti ya Uganda ne gavumenti ey'e Congo etukkirizingana ntugenda okukola amadwaliro eri sayidi y'e Congo ag'okujjanjaba abo bonna Abakongo abalina ekirwadde. Katwakamala kutandika eddwaliro lirimu ne laboratory mu kitundu kya Aru eri opposite West Nile, n'ekitundu eky'Ekasenyi ekiri opposite Toroko ne Lake Albert. Nti kubanga tetwandiyagadde nti abakongo abalina ekirwadde bajje mu Uganda, twagala tubajanjabire mu bitundu ebya Kongo. Ate twasindikayo abasawo baffe weebali. So tusaba abo bonna abali ku boda ya Kongo kuva West Nile, Bunyoro, Toro, Kigezi, abo bonna abaliraanye Kongo nti mubeere bagenderevu, mubeere alert. Oba mulabye omuntu yenna nti avudde Kongo, mubuulire abakulembeze. N'obwolaba omuntu talina obubonero obulaga nti ayinza kuba alina ekirwadde ekya Ebola, kati mumutwale mu ddwaliro eriri kumpi, oba waliwo essimu gyegenda kubasomera, musobola okuwa essimu eri toll free, kitegeeza nti tekusaba sente, osobola kukuba n'obwoba tolina sente ku simu, eri 0800 M00 066. Kanjiddemu 0800 M00 066. Oba osobola kusindika akamessage ku simu aka SMS ku namba 67767. So kati tulangiridde nti Uganda ekirwadde kya Ebola kati kiweerewo, kitegeeza nti abagenyi abaagala kukyalira eggwanga, abo bonna bamusigansimbi abaagala kujja wano mu Uganda okukola eby'obusuubuzi, n'abantu bonna ensi yonna kati bali free bajje, tewali ekibatiisa ekikwatagana n'ekirwadde ekya Ebola. So tusaba amawanga gonna agabadde gagaddewo nti abantu baabwe tebasobola kujja mu Uganda, ekyo bakiyimirize kubanga tewakyaliwo kizibu ekya Ebola mu ggwanga lyaffe. Mwebale nnyo.
Some of the measures that were taken was closure of the borders and to the community. What are the steps that have been taken after the announcements that were made to close all the markets? And
let me start with the 42 days by Biamukama from Mama FM, who said when we were at Marago Treatment Center, we said we are starting the countdown, and we have been counting. And now we have come, we are telling you the 42 days are over. The good thing, it is the same team, the same people who are telling you. Yes, traditionally, we have been counting from the last patient discharged, like we communicated in Marago. But we have since reviewed the science. Why do you count 42 days? You count 42 days because the incubation period of Ebola is 21 days. When you get infected, you can develop symptoms in a period of 2 to 21 days. So we usually count 2 cycles of incubation period. And why you are counting those days is that you are suspecting that there could be local transmission going on which you have not detected. So within 42 days, if there was an infection somewhere in the country, it will have come out through symptoms. That's why we count 2 cycles. But now, the other gentleman with this, I said it in the statement, the other gentleman we discharged at Marago, we looked at the dynamics. Who was he? This is a person who hid in a cargo truck coming from DRC. He hid and came as luggage, as a part of the contents of the cargo truck. And when he reached town, he called, and then he came, was hospitalized. So he did not expose his sickness to any person that we confirmed. So meaning that there is no contact, there is no person who was at risk from this person. That's why we went backwards and went to the last one we had discharged. Because you see, you must be informed by science. This is not witchcraft. This is science. The reason why we count 42 days is that you are looking at the last case you discharged. Did that case expose some people to a risk? And in the case there is some risk exposed, then you give it time for it to emerge through symptoms. But in this case of the Congolese, we went back and traced. He did not expose anybody to the risk of Ebola infection. The one who could have been of risk is the other one of 16th June. That's why now we made an adjustment. It is scientific. It is scientific that the one who could have posed a risk that justifies the 42 days is the other one who was discharged on 16th June. That's why now we counted the 42 days. Instead of the other Congolese, we now went backwards and counted from the one of 16th June. Now the 42 days have ended. So we are now sure from a scientific standpoint there is no more risk within Uganda arising from those 20 cases that we admitted and managed. Does the WHO agree with this? Definitely yes. WHO also is moved by science. And actually even all these protocols of 42 days were developed here in Uganda because Ebola is an African disease. And we have had, this was the 9th outbreak. And the lesson is learned and the experience that we went through managing different outbreaks is actually what informed most of these protocols which we use to manage Ebola. So there is no contradiction at all. And in any case, what is important is for us to be persuaded and convinced of the science and not whether we satisfy anybody outside. As long as we are convinced that what we are doing is right and scientifically correct, then even the WHO and others will adjust and conform to the science. And the learning never ends, so we are also teaching the international community that when you are managing an imported outbreak, there are these observations you have to look at. Hassan, you were asking, will we now engage the US and other countries to lift the restrictions and the travel bans that have been imposed? The answer is yes. That's why in the last paragraph which I read, you were saying now Uganda is Ebola-free and is open to tourists, international travel, investors. Nobody should fear coming to Uganda on the basis of a risk of Ebola. But we have also argued, before even this statement, that the restrictions imposed by these countries were not necessarily backed by public health science. I have said this severally in the public platforms, that the Ebola disease was first identified in 1976 in the Congo and Sudan, now South Sudan. That means we have had 50 years of Ebola disease. Congo is witnessing the 17th outbreak. Uganda, this outbreak which we are concluding, this is the 9th. When you do a count in Africa, we have had up to 40 outbreaks and flare-ups because Ebola has also been in countries in Western Africa. But in the 50 years of those outbreaks, less than 30 cases of Ebola have been exported outside Africa. Actually, to be exact, if you include the recent case of France, there are 29 cases that have been exported out of Africa. And the majority of these cases are doctors and health workers who are evacuated to Europe, to America for further treatment when they contract Ebola as they manage Ebola cases. So, meaning there is minimal risk of exporting Ebola through international travel. International travel, that is the evidence. So that means that the decision is taken by these countries largely out of fear but not backed by science. Because with science, we go with evidence. Because in the last 50 years, if Ebola was as risky as, say, COVID, then we would have seen a global transmission in Asia and Europe and so forth because of the many outbreaks we have had in Africa. So going forward, like you asked, we are going to continue engaging countries like the US, Canada, United Arab Emirates, and others which had imposed these restrictions to rethink and reconsider those restrictions so that the travel bans and restrictions can be lifted and we continue moving. You were asking, my colleagues will add additional points. What has Uganda done that other countries like DRC have failed to do, and we've been able to contain this outbreak? While it may be in a neighboring country, the story is not as rosy as what is here. Well, I said some of these in the statement. You see, we received a Congolese national who entered the country on the 10th of May, and he was hospitalized, died on the 14th, but the samples which had been taken confirmed Ebola on the 15th May. And that's when we declared that there is an outbreak of Ebola. So early detection and announcing. Some people have been saying in Parliament, I was accused the Minister of Health is reckless. And why did you announce? By the shadow Minister of Health. And I told her, I think reckless would have meant if we kept quiet and many Ugandans get infected, then you could say we are reckless. But we announced that there is a problem of Ebola. And then we activated our response system and made every person to be on the alert, especially the border communities, Uganda, DRC border communities. We closed the points of entry, the border. We, like you said, stopped community gatherings, like markets, weddings, and all events which gather many people. We put them on hold, especially in the border communities, so that we can disrupt this potential transmission in those communities. And the sensitization. We asked the radios and media platforms, especially on the border axis, to relay and broadcast messages regularly, daily, and some of these radios are picked on the other side of Congo. So, and then we strengthened our laboratory system. We activated our surveillance system so that any case that is in Uganda is picked early enough. So a combination of all those interventions is what helped us to contain. For instance, you recall, with the guidance of the President, we announced that we have postponed the Mugongo event, which happens on the 3rd June. And when that announcement was made, already many Congolese were already trekking into Uganda as pilgrims. If, for instance, we had allowed that Namugongo celebration, that would have been a super spreader event. Probably today the story would be different. So, acting early and mobilizing Ugandans and building on the capacity and strength we have built over the years, because we managed Ebola before, we had COVID. So a combination of all these is what helped us contain this. Probably when you go to our other neighboring countries, their response may not be as robust as it has been in Uganda. But we are going to continue documenting all these for the international community and scholars to learn how we can manage some of these disease outbreaks. Lastly, you asked about the border. Are we lifting the measures which we had announced? No. In our statement, we are saying, although we are declaring Uganda Ebola-free, but there is still a risk because our neighbors in the DRC are still having a big challenge. And therefore, the border with the DRC remains closed. The measures which we announced in the border communities still stand. We shall gradually be advising the border communities on additional or flexibly maybe lifting some of the measures. But for now, our guidance is that the measures which we had imposed and guided on in the border communities remain in force as we observe what happens across the DRC.